This is Justin Chamberlain's NUR 3069 complete head to toe final video assessment. So I'm going to go ahead and make sure all my equipment is clean, my hands are washed. We'll go ahead and knock on my patient's door. Good morning, Mrs. Chamberlain. I'm Justin.
Morning.
I'm going to be the nurse that's taking care of you today. First of all, how are you feeling?
Fine.
Fine, great. I'd like to start with some of your medical history. Do you have any medical problems in the past?
No.
Any surgeries?
No.
Do you take any medications on a daily basis?
Birth control.
Birth control. Okay. And any family history of any heart problems, strokes, cancers, diabetes?
No.
Nothing. Okay. Do you smoke cigarettes?
No.
Drink alcohol?
Occasionally.
Occasionally. And I'm assuming no drug use?
No.
When was your last menstrual cycle?
Last week.
A week ago. Okay. And is anything, you having any pain anywhere?
No.
No. All right. So I'm going to get an initial set of vital signs. I'm going to check your temperature. I'm going to check your heart rate. So temperature, I noticed 98.5. Heart rate, I'm checking for a full minute, 68. Her pulse ox is 98%. Blood pressure is 113 over 63. And respirations are 16 and unlabored. And I'm going to, so when I walked in the room, I did a real quick little assessment. I noticed my patient's not in any distress. Her respirations look even and unlabored. She looks clean, well-kempt, well-nourished. She looks like she has good hygiene, so nothing stands out to me that would would alarm me to stop my initial head-to-toe assessment. My patient looks safe. I'm going to do a safety check. I'm going to check my non-working rails are up on my stretcher, on my bed, I should say. My working rails are down. I'm at a comfortable height. I'm going to ensure my patient's safety, maybe have some non-slip footwear, make sure the call bell's in reach. I got adequate lighting. So I am pretty much ready to go with my head-to-toe assessment. So I'm going to start initially here with the scalp. I'm going to assess the scalp. It looks a little white, which would be normal. I don't appreciate any dandruff. The hair is coarse and abundant. It's shiny, maybe a few split ends, but overall looks good. So, any pain anywhere here? Nowhere that I'm touching?
No.
Great. So I'm going to go ahead and move on to the face. I'm checking for any scars, birthmarks, any masses, lesions, nothing. I'm checking any pain here.
No.
Checking the temporal arteries. Any pain if I press here?
No.
No. Any pain here in the front
No.
maxillary? No. Good. Can you open and close your jaw? I'm checking the TMJ. I don't hear or feel any clicking. Will you go ahead and smile for me? Great. Her smile is symmetrical. So that's great. So next I'm going to go ahead and move on to, I'm going to check some nerves that run into your face. So I'd like you to close your eyes. For the record, this is 5th cranial nerve. I'm going to go ahead and run my finger over your forehead. Can you feel that?
Yes.
How about the cheek?
Yes.
And the other cheek?
Yes.
Good. I'm checking corneal reflexes. She's got corneal reflexes. I'm seeing her blink. All right. So can you squeeze your eyes shut for me? Can you puff out your cheeks? Can you raise your eyebrows? And can you clench your teeth and smile? So, okay. That looks like that would be the 7th cranial nerve. Sorry, a 7th cranial nerve. So the 7th cranial nerve is intact. Okay, so I'm going to go ahead. I want to move on to her eyebrows. Her eyebrows are, you get those threaded? They look phenomenal, by the way. So the eyebrows are abundant. There's no loss of hair or anything like that. I'm noticing the eyelashes, same thing, no loss of hair. I'm looking at the eyelids. I don't see any drooping of the eyelids. I'm going to go ahead and pull down. I'm checking the conjunctivae. They look pink. Will you go ahead and look at me? I'm looking at the sclera. It is white. The pupil looks intact, and as well as does the iris. All right. Okay, so I'm going to go ahead and have you. All right, let me do. I'm going to check your eyes. So let me check some more of these cranial nerves. So I'm going to go ahead and have you follow this pen with your eyes. Okay, I'm going to go in a clockwise motion around. Great. So that was one of the cranial nerves that I just checked. Cranial nerve 3, I believe. And that looked normal. I didn't notice any jerky movements or nystagmus. And I can go ahead and bring her out of the room. I can go ahead and get a visual acuity on her using a Snellen chart 20 feet away and check her vision, which her vision is not very well. So I'm going to go ahead and turn out the light. I have my handy pen light here, where I'm going to go ahead and, so just look straight at me. I'm going to check that her pupils are equal, round, reactive to light to accommodation, which they are. Great. Pupils currently now are about 3 millimeters. So while I have the light off, I'm going to go ahead and have you open your mouth. Stick out your tongue. Can you say ah? I'm checking. Tonsils look 2+. I'm assessing the tongue. It looks pink, moist. I'm looking at her teeth. I don't appreciate any significant dental decay or caries. I'm going to go ahead and turn this light back on. So I didn't appreciate any, I don't know if I should get any more. I didn't appreciate any dental caries. So moving on, I'm going to go ahead and start to inspect the ears. I'm checking for any tenderness, any pain there? No? Okay. I'm going to go ahead and use my otoscope. Check the tympanic membranes. They look gray and shiny. Great. Minimum cerumen in there. Okay, I'm going to go ahead and check inside of the nose. Great, I don't notice a deviated septum. I appreciate no polyps. Okay, next I'm going to go ahead and start feeling for the lymph nodes in your neck. Any pain, any tenderness?
No.
Trachea pubis midline. Can you go ahead and swallow for me? Great. I'm going to go ahead and palpate the supraclavicular lymph nodes and any pain in there.
No.
Appreciating the clavicles. Great, no pain in there. Is that enough?
No.
Okay.
No, that was a question.
Focus here. All right, I'm going to go ahead and check for range of motion in your neck. Any pain there?
Yes.
A little bit of pain. Okay. You've been working out too hard.
Sounds about right.
So I would say range of motion would be about 5+ on the range of motion. Okay. And I assess that the trachea is in a good midline position. I'm appreciating no JVD. The lymph nodes were not palpable, no masses, anything like that. Okay, so I'm going to go ahead and whisper something in your ear. Great. Okay, so that was cranial nerve 4. I believe that's the trochlear cranial nerve I just assessed for, and it seems to be intact. Okay. How's your memory been?
Good.
Good. Are you able to remember recent
Yes.
things that happened and memories in the past?
Mm-hmm.
So great. So the neurological status of this patient, I would say, is good. She can remember recent activities, so her long-term and her short-term memory is intact. All right. So the next thing I'm going to have you do is I'm going to have you touch my finger to your nose, and I'm going to have you follow it. So take your finger, touch it to my finger, and touch it to your nose. Yep, keep going. Good. Great. Okay. So that's great. All right. So next, I'm going to go ahead and I'm going to go ahead and assess your breathing. All right. So initially, like I said, her respiration is even, unlabored. I didn't notice any accessory muscle use, no retractions, anything to suggest that she was having some shortness of breath. So I'm going to go ahead and, okay, let me have you lay down now. Okay, so I'm going to go ahead, first I'm going to initially listen to, let me assess your upper extremities. So, any pain in here, if I do this?
No.
How about this one? You have full range of motion. Good. I'm assessing the fingernails. They're not cyanotic. I notice no clubbing, no webbing in the fingers. She has all 5 fingers. I'm checking for radial pulse. She's got a good radial pulse. Checking for an ulnar pulse. Good. And again on this side, I can go ahead and walk around my bed. Good radial pulse. Good ulnar pulse. Great. I can go ahead and take this stuff out. Okay. So now, I'm going to, let me have you lay on your, well, no, I'm just going to have you lay like that. Okay. So first I'm going to check the aortic valve. This is going to be second intercostal space on the sternal border. And then the pulmonic valve. Second intercostal space left of the border, sternal border. And then the tricuspid. Of course, I would be under the gamma. And then mitral, fifth, midclavicular. Okay. And then I'm going to go ahead and put my hand here to feel for the PMI, point of maximal impulse. Great, that feels good. And then finally, I know I got an initial set of vitals on her. I can put my stethoscope over the PMI and I can go get and listen for 1 minute for an apical heart rate. Apical heart rate would be 78. Great. And with listening to the heart sounds, I heard no murmurs, no friction rubs, no gallops, nothing abnormal, no muffled heart sounds, and that would be good. Okay, next I'll go ahead and percuss. And I hear dullness here, and then I hear a fullness when percussing over the heart, obviously because the lungs are hollow and the heart is a solid organ. So now let me have you sit up again. So this would be a breast. I'm going to go through how we would do a breast examination on a woman. So you would put your hands up over your head. I would have you lean forward, and thank God I'm your wife. I would
Thank God you're my wife.
thank God I'm your husband. And I would appreciate the breast, feeling for any masses, soreness, tenderness. Check the the screen went off. Check the nipples for any drainage. Again, for any tenderness. And now, are you currently breastfeeding?
No, I'm not.
No. Great. Okay. So next, let me move on to your abdomen. So initially, I'm going to inspect the abdomen. I appreciate no lesions, pulsating masses, obvious masses. So, great. Next, I'm going to auscultate. I'm going to start with the left lower quadrant. And I'm listening for vowel sounds. I'm listening for like a gurgling noise. She's got vowel sounds in all four quadrants. So next I'm going to start with a light palpation, where I'm going to palpate. I'm feeling for any masses, looking for any tenderness that she may have, any rebound tenderness, and I appreciate none. Next would be our deep palpation, where I'm palpating deeply. Again, checking for any masses, noting for any tenderness. Next, we're going to go ahead and I'm going to have you lay on your, or that's fine, I'm going to have you lay like this. So, I'm going to go ahead and hook the liver, checking for the liver. Great, I don't appreciate the liver. And I'm going to go ahead and do the same thing on this side. Hook, press for the spleen. And it's not appreciated, so that means those organs are not engorged. They're probably of the normal size. Alright, so next let me have you sit up straight. I'm going to inspect the flank. I don't appreciate any lesions or anything like that. I'm going to go ahead and palpate for the kidneys. Any pain if I do that?
No.
Great. Alright, and I can do the same thing. I can press down here, palpate for the kidney on the right, palpate for the kidney on the left. Great. So next, how have your bowel movements been?
Fine.
Fine. Great. Any burning when you pee?
No.
Nothing. Okay. Great. And so next, I'm going to go ahead and start assessing the legs. So I'm checking the legs for any masses, any lesions, any engorged veins, any discolored areas that would be concerning to me. I'm moving down, I'm checking the kneecaps for stability. I'm checking for range of motion in the feet. How are those?
Fine.
The feet are warm, they're pink, they're dry. I'm checking the toes. I don't see any ulcerations, no discoloration, no bruising, and in between the toes looks great. I'm going to go ahead and check the dorsalis pedis pulses. She's got great dorsalis pedis pulses. Go ahead and check posterior tibial pulses. She's got great posterior tibial pulses. All right. Now I'm going to let me go ahead and inspect your back. I know I palpated your kidney. So I'm inspecting the back. I'm checking to see that the scapula appear normal. They don't appear, there's no deformity. They're not bulging. I'm checking the spine. The spine appears midline. And I don't see any, again, bulging. Any tenderness here in your back? No. Great. So the back and the spine looks good. While I'm back here, I'm going to go ahead and listen to your lung sounds. Of course, this is with the gown open. I'm going to go ahead and have you take a deep breath. Great. Great. So all the lung sounds were clear in the posterior. So now I'm going to have you, let me have you stand up over here. Okay. I'm going to have you stand up on one leg. Great. And stand up on the other leg. I'm assessing for her balance. Good. Go ahead and sit for me. Okay, now I'm going to have you drag this shin, or this heel, along this shin for me. Up and down. Good. Now do the other one. Great. All right. I guess the last thing for me to do would be to assess her genitals. So, which I'm not going to do. In order to do that, obviously, she would have to be, I would obviously need a female in the room if I was going to do that. I'd get her undressed, I'd have my speculum, I would check for any lesions, any masses that she would have on the outside. I would check the disbursement of the hair. I would use my speculum, check the cervix, obtain any specimens I may need. I can do a bimanual exam to feel for the cervix, to feel if there was any tenderness within the cervix. Next, I can go ahead and check the rectum and ensure there's no external hemorrhoids. And that was it. The other thing I didn't mention is we can do some patellar reflexes here while you're sitting on the side of the bed. Oh, sorry. We can do some patellar reflexes here while she's sitting on the side of the bed. And then again, I can do, for another reflex, I can do a Babinski, where I'm dragging something along the bottom of her feet. And that would be it. That concludes my head to toe physical assessment. Thank you, Mrs. Chamberlain.
Welcome.